Guys, it was just about 50 rupees that from my salary that I deserved was cut. Also, not just 50, once it happened that 80 rupees was also cut. What actually was happening is the dentist I was working with was used to give the round figure salary. The doctor, the dentist would give 1,000 rupees and not just 1050. So that was the thing that used to happen. And it felt bad because that was the salary or the money that I deserved. It was not something extra. And moreover, that dentist or doctor was super rich. So sometimes it hurts when 50 or 100 rupees are cut, but I guess that's part of a struggle. However, you will also meet some dentists that what they do is they also give the round figure salary, but they give 50 or 100 more. For example, 1050 is the salary that you earned, so they will give you 1100 rupees, 1100. Guys, there were days when maybe I wanted to have my own struggle journey. I joined the clinic, but I was given only two chuttis, only two off days in a month. I mean, that was insane because every human being deserves one holiday every week, no matter what day it is. So, and the Sundays were working half day. Like, it's still 2 p.m., but at least I have to go every single day. Out of 30 days, I have to go 28 days and I have to return. So, what's the point of having a half day? I couldn't understand, and I was like, later I realized like why I joined the clinic. So you should be very clear with the time of the clinic, with the off day, no matter what day of the week it is, it's okay, but once a day holiday is a must. And salary, and you would must be very clear about the break timings, because there were clinics that I need 30 minutes a break of all the hours I'm working, guys. 30 minutes are the basics. I mean, come on. How can I just have lunch in a small clinic and I do not go out? I love sunlight. I love fresh air. So I have to go for 30 minutes. So sometimes the dentist you are working for in the clinic might get, little off, thinking that you are taking an extra time. But for me, if I have taken 30 minutes of break, that means 30 minutes. Even I will be back with 28, 29 minutes. So you must be very clear with these things, guys. Otherwise, these are sometimes like makes your journey more complicated. There was one incident that happened that I really, really, really felt very bad. That was I met somebody for the job, and the offer letter was given. But what happened was the offer letter had the salary mentioned, but after 15 days or 3 weeks, they call me up and they say that I need to learn few stuffs. I'm new to this, so they will might not be able to give me the full salary. I really appreciate that. I do not mean that uh, they deducted my salary. What I meant is what was written in the offer letter was not fulfilled. So that was something that really hurt. In the clinics you join, guys, you will be dental receptionist, means you will have to contact and call patients, ask for feedback after the treatment, everything, book appointments. You will be dentist, of course. You will be dental assistant. You might be suctioning, you might be mixing materials, you might have to record what all the materials are there in the clinic. You have to keep a record of that. And of course you will be dental hygienist. Actually, the scaling and the gum hygiene part is done by the dental hygienist. If you appear or if you go to any government hospital, there you won't ever get a scaling treatment to be done, because that is taken care by the dental hygienist. In clinics also, this thing must be done by the dental hygienist, but we have to keep one dental hygienist. The cost is more, so that is why the dentists usually do the scaling by themselves, but that part is usually done by a dental hygienist. So when you join a clinic, these all you have to do, and somehow at the starting it's a good thing because you must know your field from zero. Guys, I have also did the mopping of the floor, but wait, it was not anybody's fault. nobody asked me to do the cleaning of the floor. But that day the clinic, it was like 2-3 days since the cleaner came and cleaned it up, and dental assistant was not there. So ma'am thought the clinic was a little more kind of a dirty and unhygienic. So ma'am started cleaning the floor, and of course I was there. So seeing ma'am do that, in terms of respect, I of course requested her if I could do it. But yes, these all things do happen when you join a clinic. This everything, this video is all about the true events of what happened with me, what all are the experiences that happened with me. So this can happen with you too. There will be bad days, good days, horrible days, awesome days. So this is the part of the struggle, this is the part of the journey, and it's completely okay. What happens is your dentist might say, the person you're working for, that 1 week or something, 10 days salary won't be able to give, and the clinics are shut down because it's on rent. So these things will happen, and we have to understand that they are trying their best, we are also trying our best. Both are suffering from this COVID era. Everybody has been influenced by this, so it's okay. Patient will tell you on your face that he's not satisfied, or he will tell the senior doctor that the doctor under you is not sufficient, is not efficient to do this procedure, so he's not satisfied. Or there can be a third case scenario, that the patient just told the senior doctor that she was good enough, but I think it would be good if you had done the treatment. But your senior doctor tells you a different story, having said that कि patient was like the patient आपकी तो बहुत बुराई कर रहा था, बोल रहा था आपको ये भी नहीं आता, वो भी नहीं आता, you were not good enough, so all cases are there, and it happens, and it's also okay, because you will never know the exact truth what happened. And guys, out of 1,000 patients, there will be 10 to 15% patients that won't be satisfied and won't be happy with your treatment, and that is completely okay. I don't think there is any doctor or dentist on this earth with whom every patient is like ये डॉक्टर ही बेस्ट है, ये तो 100% सारे केसेस अच्छा करता है. That does not happen, because the more senior you get, the more experience you get, and experience comes from the bad experience. In the journey you will find a good mentor, guys, because I found one. I have mentioned that in the dentistry unlocked also. My mentor is Dr. Prakhar Kumar. I am not working with him, but it was the first clinic that I ever joined while I was in my internship, and I learned a lot from him, the basic values that actually make a good doctor, and that's the most important at the end. And when you do, make sure you learn the best from him. I joined 2 charitable clinics, guys, and out of one was I was having doubts, but at the end I got it confirmed that it was a quack. In Acharya Bhikshu Government Hospital, guys, people usually are so some people will be like that you have to literally raise your voice, and you will meet some people who will, like, to be honestly, just fall at your feet. They touch your feet. I'm so small, so younger to you, and you are touching my feet. So you will meet all kinds of people every time, all kinds of patients, seniors. So at least at the end, be always humble and kind, because when you enter a government hospital, you will just be shocked what kind of people come, and how many times of a day they have to come, stand in line early in the morning just to save few rupees. Now guys, especially girls, this happens. You have to stay very professional, and zyada hasna nahi hai, because I got the compliments that I smile a lot and I'm laughing, but that was not the case. I'm never laughing. Maybe I have a smiley face, I don't know. That once happened in a college also, my college, while internship ma'am was taking an attendance, and she said, why are you laughing? And I wasn't, I was just looking at the register and seeing my attendance. So this things happens. There was a patient, and in the afternoon the dentist which I was working for used to go to the home for having lunch and and then having a break and then coming back. So what happens, the patient came in the afternoon hours, and I was attending the patient. I diagnosed, I consulted, and I was like planning for the treatment. So I just messaged the doc that this is happening, this tooth needs to be corrected, this is the caries, and I am starting with this procedure. And just I was talking with the patient, he was asking some questions. So that patient asked me like, can he have my number? And I was like, sorry sir, I you can contact the clinic number. So he came, we got the treatment done, met the senior doctor, everything happened. But later, on his last day of appointment, he said something to the senior doctor, which I later came to know was like, the doctor जो आपके अंडर है ना, वो बिल्कुल भी प्रोफेशनल नहीं है, वो बिल्कुल भी, I don't remember the exact words guys, but that was not which I would like to say online. That he meant I was not professional and I wasn't respectable, just because I did not save his number and just because he couldn't see my WhatsApp DP. There was another case. Battisi was still growing at that time, and every patient I meet, no matter where, I always tell them that if you have any dental queries or if you want to know more about dental health, then you can visit this Facebook, Instagram, or whatever. And every patient I used to message from my Instagram account so that he knows that a doctor is available. And that patient, I messaged him also like the other. It was a professional long message, and that patient thought that I was messaging him outside the hours, but that was not the case. So girls, you have to be really very professional, be very careful, and that is why cameras are so important in the dental clinics. And the most painful thing was the senior doctor was a girl, was a woman, and she couldn't able to understand or trust me. And like it feels bad when a woman is not able to trust a woman. And you have to maintain a little distance from a dental assistant. I'm not saying you can have a good rapport with them, you can, because dental assistant is the backbone of the clinic, but a little, a line, a boundary that, except this, I'm not going to talk about any other things, because then it tends to get a little messy. And I do have still in contact with some awesome dental assistant bhaiyas and uncles who are awesome, and I talk to them like, how is your family, how is COVID, how are you? And they tell from like their 11-12 years of experiences. It's more than I have total of like BDS and the graduation years. So they know a lot about patients, they have dealt with more patients than I had. So they share about their experiences, and you will meet both, like a chipku dental assistant and a good dental assistant. So always maintain a little boundary. Patients compliments you about your writing, that how can a doctor have a good writing. And they also compliment you like, I was complimented like I look so young and confident, how can I be a doctor? And in both the scenarios I was confused, that was it a compliment or was it like I should be thinking of something if the patient is not able to have confidence in me. But I took both of them as a compliment, and I guess somewhat the patients meant that as a compliment. I went to an interview, guys, and that doctor put his legs on the table. He smoked a cigarette in front of me, and no doubt he was one of the best dentists of that area, was most senior. Then he started asking me questions like the dangerous area of the face. I told him the correct answer, and then we were discussing about the instruments and everything. So and he said that I won't be able to pay you, because the more the senior doctor is, sometimes they pay you none or very less. But he said, you should be grateful that I'm not asking you for money like the other dentists do, to teach you or to give you experience. And just the way, guys, that is not a way, that is where you write prescriptions, yet you deal with consultations and you deal with patients, and you are putting your legs on the table and having a cigarette in front of me. That is something I will never join a clinic, even if I get a good salary job. I personally never wanted to join a hospital, private one, Because when you enter a private hospital, sometimes it gets like business minded kind of a thing, like we are trying to fetch out something from the patient even if it's not able to, and even if it's not necessary. And I'm not saying that is true for everybody, every hospital, just my personal like view. And I never wanted to join any dental clinic which has chains, which has many centers all over India, because then I guess it loses its authenticity and quality. Because we are not running a restaurant, it's a clinic, it's your skills, it's little difficult to manage everything. I also, keep on, while searching for clinics, I went to another clinic, and that clinic I went for 10 days and no pay was given because I was on observation. But that 10 days, guys, I have like learned every single minute due to the time differences, like subah 9 se baje 8 baje tak, and I have to sit there also. So it was quite long. I couldn't come back home because home was far. So due to salary and due to time, I couldn't join that. No matter where you go, which clinic you join, get the best of everything. What I always do is, guys, if there is some senior doing patients, so I always go and stand by and see what he's doing. You get into conversation, the senior asks you what are the things spotting, like spotters, they give you to identify, what I'm doing. He might give you also some treatment to do on the patient. So that is why I always stand next to the senior doctor, always, no matter, even if he's doing scaling also. So sometimes people interpret it a wrong way, like I do not know anything and I'm standing beside the senior doctor, as we used to do in our college times. But that's not the case, guys. People will interpret, people will say, people have their own judgments and opinions, but at the end you should know what you're doing, and you should have a sound sleep with the satisfaction that you made the best out of this day. There might be some blaming games. The senior doctor might blame you, like, don't you know anything about this, how you could do this, don't you know कि इसको ऐसा ऐसा करते हैं. And if the treatment goes wrong, they try to put it on the patient or on you. Also, there will be cases when the doctor dentist takes side. I'm not saying that they take the wrong side, I'm just saying they take the right side, because you will meet every kind of patient, guys. So uh, dentist might take your side, as in you might be correct in that situation. So you will find both kind of doctors. I have been to a clinic where the clinic asked me to wear a single mask for 3 days, and I was like, what? And because, guys, if I open my clinic, if I don't get patients on the first day, second day and third day I get them, I can wear that mask considering I have attended no patients, and to save, and maybe I can reuse it, autoclave it, whatever. But what if I'm doing one patient a day? What if I'm doing two patients a day and then no patient? But how can I wear, if I'm doing even single patient, how can I wear that mask for 3 days? And especially after this COVID, it was like, what? So and there were clinics with autoclave gloves. It's okay because gloves, at least they're single use, but at least you're autoclaving them. But how can I wear a mask for 3 days without even autoclave? And guys, I broke a file in two patients. One was in the government hospital and one was in a private clinic. In the private clinic, the doctor was kind enough to understand, and it was my mistake because I just thought, I was new there and I just thought the dental assistant would have checked the files, and I did not check the files before inserting it into the canal. So that is something you always should check, because at the end you are the one who are responsible for that tooth, and he did not tell the patient. But if it was my clinic, I would have definitely told the patient, because I did that in the government hospital too. So what happens is, when you break a file and you tell the patient after seeing the x-ray that this all happened, the patient gets worried, and he will like, the patient in the Acharya Bhikshu was like, I think it's okay if I don't get the treatment done further. I'm okay with it. And I was like, no, it's not okay. This will be okay. And I made sure that I take out the pulp, and it was at, just the, like, it was the fit GP. It felt like the file that was broken in the apical third, and it was like perfect, like fit. And I made sure, and she was having no pain at all. So these things happen, and at least I always wanted to tell the patient if I made something. And it's not a blunder, guys. files टूटती हैं, it's basic. And you know, nobody on Instagram or videos or anywhere will tell you that okay, it's okay to have these things happen. But I don't think any endodontist or any dentist who have done quite enough RCTs hasn't broken a single file. I can't believe that. Even if they haven't, I guess they haven't practiced enough RCTs, because it is normal and it's not a blunder or something major. So you have to check for these and be honest with yourself, be honest with the patient, and be honest with your senior doctor. Tell him that okay, I don't know this, just give me one demo and I'm a quick learner, I will be able to learn it. Yes, I did this mistake in the patient, I will make sure I do not do that again. Be honest. Honesty will give you a very good sleep at night, trust me, and that's the most important thing in life. There will be clinics, guys, in which you do something on the patient, they will give looks to you and to their other colleagues like ये क्या कर रही है, ये क्या कर रहा है. And there will be, you know, sometimes you will meet your seniors who will make your journey easy. No matter which clinic you join, guys, have respect for seniors. At the end, they are seniors, they know more from the experiences than you know. And be respectful for every clinic you join, because they are the ones who are providing you with the job. Sometimes, you know, when you are about to leave the clinic, it's closing time, sometimes it happens that a case get delayed and you have to stay back, but make sure that doesn't get into a habit. Your timings are most important, guys. Dentistry is just part of a life, dental clinic is just part of life, it's not a life. We do have a personal life too. So इसका मतलब ये नहीं है कि अगर आपको 8 o'clock जाना है तो आप 8:30 तक रोज रुकोगे. Go at 8 o'clock. I used to get ready at 7:55, because I know if I do not catch that bus, I will be standing alone with many other guys and the boys, and it will make me just uncomfortable. Not that I'm like literally scared, but it will just make me uncomfortable. So I have to catch that bus, I have to reach my home, which is 1.5 hour far. So these all things matter. पूछते रहो, सीखते रहो, जो क्वेश्चन आता है माइंड में पूछ लो, guys. It doesn't matter. आपको कोई डाउट्स हैं, पूछो. हैव अ कन्वर्सेशन विद योर डॉक्टर. अगर आपको कोई प्रॉब्लम है, कुछ चीज़, यू नो, थिंग्स आर गेटिंग अनकंफर्टेबल, उनको कुछ मिसकंसेप्शन है, आपको कुछ है, टॉक इट आउट. व्हेन द पेशेंट ओपन्स द माउथ, नो मैटर इफ ही इज अ सुपरस्टार और इफ ही इज जस्ट अ रिक्शे वाला, नथिंग शुड मैटर यू एक्सेप्ट दैट टूथ, एक्सेप्ट दैट चीफ कंप्लेंट, एक्सेप्ट दैट he is healthy and he's not in pain. Except that, nothing should matter you. And keep your hairs, girls, especially inside the apron, because sometimes the patient might, you know, poke you, talk to you like, can you please keep your hair inside, and he might get uncomfortable. In the private dental clinics, guys, if the patient does ooh ah ow ouch, we are reasonable for it. In government hospital, patients are coming to us, they are like coming with the sense of feeling that the doctor will take care of us. So please, in the government hospital, be humble. You never know what one is dealing with. Be clear to the patient कि अगर आपने RCT BMP किया है, क्लोज ड्रेसिंग दी है, दर्द हो सकता है, एक्सट्रैक्शन किया है, ये इंस्ट्रक्शंस फॉलो करने हैं, लेकिन फिर भी कभी कभी दर्द हो सकता है. बी असर्टिव. अगर गाइज द हार्डेस्ट सब्सटेंस इन द बॉडी, इनामल, अगर कोई पेशेंट खराब कर लेता है, तो हमारे डेंटल मटेरियल्स तो नेचुरल को कभी बीट कर ही नहीं सकते हैं, तो वो भी खराब हो सकते हैं. हार्ट में जब स्टंट डलता है तो देयर इज नो गारंटी फॉर इट. देन व्हाई शुड अ डेंटिस्ट हैव अ गारंटी? Although we have very high expectations, because whenever we see somebody smile, and teeth are the most important things of the face. Agreed, but that doesn't gives us to guarantee something. And guys, जो भी हम सीख रहे हैं, whatever our struggle is, whatever we are dealing with, whatever we face, make sure we do not let that same thing happen to our juniors. Otherwise, what is the point of Battisi? What is the point of communication? What is the point of you learning from dental colleges if this happens again and again? And guys, there is one thing I have to say, the message for this video. I did not had anyone to tell me, but I am here to tell you that it's completely okay to break a file, to leave some of the toothpiece while extraction. It happens. It's okay. We all are learning, but we from intentionally, we should not do anything wrong to any patient, and we must try to correct it. We must learn it. We must see what mistakes we do so that we cannot do that again and again. This is the part of the struggle. This is the part of the beautiful journey. You are a doctor, you are a dentist. Stay safe, stay healthy. See you in the next video. And guys, it's okay. Bye.